Hello, I'm Marek Garbowski, Vascular and Endovascular Surgeon from Perth in Western Australia. I'd like to talk about a very important topic. This is strokes and stroke-like symptoms suffering by patients around the world. Strokes are extremely unpleasant and quite often life-changing events in our life. They do occur usually later in life, in our 60s, 70s, and 80s. The older we get, the more chances of stroke there is. Strokes can be related to bleeding in the brain, but majority of the strokes that occur in our community are actually related to lack of blood supply. We call them ischemic strokes. That lack of blood supply is related to usually small artery in the brain blocked by the particles that arise from the plaque. Plaque is accumulation of cholesterol and other elements within certain arteries. And the most important artery that we know is the source of those particles is internal carotid artery. So the disease of internal carotid arteries, formation of plaque, narrowing in the artery, we call it stenosis, can result in increased risk of developing stroke. Once stroke happens, unfortunately, there is no reversal. If it's a small stroke, there's a chance of improvement, but if it's a major stroke, it can be potentially fatal. Many strokes have warning signs. We call them TIAs, or transient ischemic attacks, or sometimes referred to as mini strokes. Mini strokes, or TIAs, effectively are little red flags that are telling us that there is an unstable plaque in the carotid artery, and that plaque is potentially a source of another event which can be more significant than the first one. So if you develop and have diagnosis of the TIA, it is a medical emergency. It needs to be attended by a vascular surgeon as soon as possible, because we know from the research that the sooner we intervene, the more chances of preventing another stroke. The disease in carotid arteries is treated by means of medications, which are very important. These include aspirin, controlling blood pressure, controlling cholesterol, definitely stopping smoking and controlling your diabetes as well. So the lifestyle changes are extremely important. But then we all have interventions. If your carotid disease is significantly narrow, has unstable plaque, or you already had a TIA or mini stroke, you are best off to be referred to the vascular surgeon as soon as possible for discussion regarding what can be done about it. There are a number of options available, and those include open surgery called Carotid Endarterectomy, which has been performed for many, many years and is very safe and very effective way of treating particularly symptomatic strokes. But there is also an endovascular treatment which is gaining further popularity, particularly based on recent research. This is carotid stenting, and those carotid stents can address both symptomatic carotid disease, but also those patients who have a significant narrowing in the carotid artery with no symptoms. We call it asymptomatic disease. If your carotid artery is narrow and that narrowing exceeds 70%, and that's confirmed by the good quality ultrasound, but you never had a stroke or mini stroke, you should still be referred for discussion with the vascular surgeon whether offering you intervention could potentially provide you with a lifelong benefit. If you had a stroke or mini stroke and your carotid artery is narrow and that narrowing exceeds 50%, then discussion with vascular surgeons also valued, because you might definitely consider something being done in order to prevent further stroke. So whenever you are seeing someone in your family who suffers from a stroke and undergoes investigations and has carotid disease confirmed, always consider that that carotid disease is the source of the problem and needs to be investigated further and managed appropriately. Referral to vascular surgeon, particularly after warning signs like mini stroke or TIA, is a matter of urgency, because the sooner we intervene, the better benefit, the larger benefit for the patients, the better outcome. It is very important to look after your general health and never stop your aspirin, particularly after you already suffered stroke. Continue to manage your blood pressure well, never continue smoking, and look after your diabetes. All of these things are very important in contributing to better outcomes. But if you ever suffer symptoms that sounds like a stroke, feel like a stroke, you're best off to rush to emergency and be quickly assessed. The quicker the intervention, the better the outcome.